I once gave a lecture at a conference in 2019. It was a biohacking conference. And the idea of my actual lecture was around hyperbaric therapy and health optimization medicine. Of course, that was the early days and a lot of fun during those days pre-pandemic as well. I remember I was doing a lecture and I kind of spontaneously asked the audience, how many people here in the room are taking supplements? And almost 100% of people in the room actually raised their hand, which is not surprising. I was at a biohacking conference. But then I asked the additional question, which was this: how many people are taking supplements that they need based on biomarkers that they've checked? And only about 50% of the people actually raised their hand, maybe even a little bit less than that, probably around 30% if I'm thinking about it. And this is not surprising. We get so tantalized by supplements that we hear about from colleagues and friends and influencers out there who don't see patients for a living, by the way, and really don't have a sense of what's going to happen with you. Only the way to really know what's happening with you is to check your own biometric data. Check your own labs specifically. Don't guess what's there, test. And that's what we do at Health Optimization Medicine in practice. We optimize what's called the metabolomic level, which is real-time assessment of what's happening in your cells right now. Not what happened 10 years ago, and now it's happening in 10 years from now. It's right now. And that's really helpful because you get a sense really of the vitamins, minerals, nutrients, cofactors that you need, the environmental exposures it might be having, the other detoxification issues you might be having, heavy metals and things like that. So it's really important that if you're going to take supplements, that the majority of them are because you've tested because you need them and you're taking them. And then of course you have to retest over time because your needs are going to change depending on where you are in the life cycle of your life. And that's why we say at Health Optimization Medicine, health equals A plus B plus C. A is the absence of disease. B is the balance between anabolism and catabolism. Anabolism is the building up and catabolism is the breaking down. And C, which is the cycle of life in the organism. Where are you in the cycle? Where are you? And we try to optimize you as best we can to between 21 and 30 years of age. And so don't be that person that puts your hand down the next time I ask that question at a lecture. Be the person that says that I have measured my biometric data, my laboratory data, and I know what I need to take. And not just the basic stuff you would find at a primary care doctor's office. And, I'm an internal medicine physician and I respect internists, but they're not seeing the whole picture. That's what a comprehensive foundational lab assessment like metabolomics is going to allow you to do. So in the end, be one of the people that raises their hand next time I ask that question and take most of your supplements based on that. Now, if you want to play with other things that are not based on biometric laboratory data, that's okay too. But have a base that you're always doing. And then from there, you can build on it. And from there, you can see the true foundation laid so that everything else gets easier and your health gets optimized faster and more efficiently.